A video to introduce you to the clinical guide for those who are going out on placement in weeks 8 and 9, and also for those who are going out on placement towards the end of the semester. What we thought we could do is run through the clinical guide, what it means, what it's for, and some of the background to your clinical placement. So if you haven't already, it's probably time to head over to the assessment page of NUR1102's Moodle site and download a copy of your own clinical guide for 2016. Probably the first thing to do is put your student name, your student number and the campus on the front, and this will be basically taken with you to all of your clinical placement days, and we'll cover what that means in a moment. So on the front, put your name, student number, details. Inside there's just some information about the book, when it was published, and it's recently been updated by myself and the 1102 teaching team. Contents page here on at the beginning. This is an important little page which has got some contact details for you. So any issues with being late for a shift or being sick, calling in sick, you need to contact the clinical office on this number here. And directly you can contact the clinical coordinator, Dawn Whittle, who spoke to you earlier in the semester. I think it was in week 3. She came to your lecture and answered some questions about your preparedness, uniform regulations, where you're going, those sorts of things. Also, if it's more to do with the academic part of your clinical placement, professional issues, please don't hesitate to contact myself if you're a Peninsula student, or Suman if you're indeed a Clayton student. So then we give a little bit of background to what clinical placement is all about, run through some of the details of the uniform. It's really quite important that you visit on the Monash page this website here, the Clinical Fieldwork Placement Handbook, which gives some very broad overall rules about clinical placement, uniforms, professional expectations, attendance expectations, how to present yourself on the day, and those sorts of things. So that's a really comprehensive handbook that you should either download and read or just read online. It's a PDF. Then we go through the objectives of the actual clinical placement, which you can read in your own time, and if you have any questions about that, you can get in touch with myself or Suman. For yourselves, down at the bottom of this page there are some details about the skills we've learnt last semester, as well as on the next page the skills that we've learned in semester 2. And this is also good to give to your clinical educator on site, as well as any preceptor that you might be buddied with on your placement, so that they're aware of the sorts of things that you have done, such as basic life support, introduction to no lift policy last semester, some things, documentation of nursing activities, and then the stuff we've done more recently this semester, such as our systems approach to patient assessment, administration of oxygen, medication administration, bandaging, slinging, which we'll do a little bit later on. There is a special note here about medication administration, and this actually has been updated since the start of the semester. So if you have downloaded this particular guide at the start of the semester, it's probably best to dump that copy, get rid of that copy, and go and re-download the updated version, because some of our venues have changed their policy regarding medication administration for first years. And that relates to this bolded section down here. So you're only ever permitted to administer oral, PR, nebulized or topical medication, so those that you put on the skin, under the direct supervision of a nurse, and in some sites medication endorsed enrolled nurse, if that particular local network allows that and that policy is in place. So good idea for you to ask that question at the start on orientation day. Orientation day, by the way, is usually on day 1, well, nearly always on day 1 of your clinical placement, and a lot of the venues won't let you continue if you haven't attended orientation day. So make sure that you're nice and prompt and on time for that one. So the next one goes through, once again, some links to the clinical Fieldwork Placement Handbook, which is a faculty-wide handbook. Read that, apprise yourself with it. Bring any questions that you have to week 7's lecture or labs so that we can discuss that in class. Then it goes through, and I won't read all of these out, but some of the expectations that we have of you as students, including being aware of the clinical placement guidelines, having refreshed your own knowledge, looking at your own notes, and also thinking about your own clinical learning needs as well as the learning objectives that we have at the start of the clinical guide. Professionalism features heavily here, being punctual and courteous, respectful of your patient's rights and confidentiality at all times. So things like handover sheets and things should be gotten rid of at the end of each shift. Don't take those home with you because they have gone missing and been found in car parks and whatnot. Neat uniforms, obviously we have been going on about that bit. We have some posters in the clinical labs about what's appropriate uniforms and what is not. The clinical office are currently finalising a new version of that, and we'll post that on Moodle as soon as that's been published. Which also goes into the rules around having no large jewellery on the fingers, no watches, no wristwatches on, no bangles or bracelets around the wrists, and really, it really is quite important. Some of the venues will send you home if you don't comply with our uniform form rules. Anyway, so I'll let you read through the clinical schools' expectations in your own leisure before we go out. So occasionally on placement, some of our students either injure themselves or are exposed to near misses while they're on placement. Any of these things, you'll have to complete one of the venues clinical incident reports, but also you'll need to visit the website I'm highlighting here on the Monash site and go to the hazard incidents and click on that, which will take you through to our safety and risk analysis hub, which is SARA, and you need to complete the details of what happened on site so that you're covered from our end of things. There are clinical briefings and debriefing sessions set up by the venues, and you're expected to go to all of those. And you'll be given the dates and times of those when you go out on placement. So if you read through that and ask any questions in next week's labs. There's also a section here which is your own personal learning goals and expectations from placement. So you might want to have a bit of a sit and a think about what you actually want to get out of placement and what you want to grow upon and what you want to what aspirations you have. And you can perhaps jot those down a little bit later on in the preparation for clinical practice part of this document on page 13. So at the end of your placement, you have some documentation to upload to Moodle, and this is one of the requirements of the clinical placement and one of the hurdle requirements of the unit. So if you don't upload these, it could in fact mean that you fail the clinical placement and in fact the unit. So it's very, very straightforward. Basically, it's all of the last pages from the summary of completed assessments onwards, and I'll scroll down to those in a minute and show you what they're all about. These need to be uploaded on the assessment page of the 1102 Moodle site, and there's a clinical placement Moodle Dropbox. You need to do that within 4 days of completing your placement. So there are a number of clinical skills that you need to complete while you're on placement. There are only 4 compulsory skills, and they are on page 16. That's physical assessment, personal hygiene, parts 1 and 2, so looking after your patient's hygiene needs on page 17 and 18, infection control and risk management on page 19, and patient mobility, parts 1 and 2, from pages 20 to 21. There are a whole host of optional skills as well, such as preparing the patient's care plans, aseptic techniques, elimination, care of the patient with an indwelling catheter, and so on and so forth. These are all competencies that are optional. By and large, most students complete all of these on placement because there's ample opportunity to do a lot of these things. So sometimes you might not get exposure to something like an indwelling catheter or somebody who's on oxygen therapy, but by and large, most of these competencies can be completed. In order to complete these competencies, it's a good idea for you to have a good open line of communication with your educators on site so that you can make a time for them to come and go through your competency assessment with those skills. When we get down to those skills, I'll show you how they work. So have a read through here about the clinical performance criteria, but basically they're based on the Nursing and Midwifery Board of Professional Standards. And I'll just scroll down and show you basically how you interpret that grading scale. We are expecting all of our students, all of you guys from first year, to be at first year level, to be at dependent level or above. So what that means basically is that you're at the lowest level, and we have an expectation that you'll be able to complete these things with a lot of support from the staff who are on site. So have a read through those, and these will apply as you progress through second year and third year, and the expectations get a little bit more demanding. So for example, here's the scale here, and at third year we expect you up around here. At the moment in third year, your competency level for clinical placement is the highlighted area down here. So this is the part that we talked about earlier, where you might have a bit of a think about your own personal goals for this, and maybe jot them down in this part and have a discussion at the start of your clinical placement with your educator. You can have a chat to me about these before you go out if you like, or to Suman over at Clayton, and see if they're realistic and if you might be able to attain those as you go. So there's some personal goals for yourself. And then what we do is we come down to, these are the parts from this page onwards, so page 14. This page onwards, at the end of your clinical placement, you need to make an appointment with your clinical educator and sit down and complete all of these. So to begin with, you'll need to do this summary page, which has your name, student number, what campus you're from, who your clinical teacher is, and they'll sign that off, where the venue is, and if there's been any absent days, which is an important thing. So absent days mean that you've missed a day, and you'll actually need to make those up during the clinical placement. So if you're sick, you'll need to make that day up. So this is just a summary of our clinical performance competencies, and whether or not you've been able to complete those, and then the educator signs off on those. So on our next page down is a little bit about our clinical assessment sheets. So these sheets here are basically our competencies. So these, for example here, the physical assessment one, are the ones that you'll make an appointment with your clinical educator during your placement for them to come and watch you and observe you as you interact with your patient and do for example in this one, it's a physical assessment, and they will go through and complete this with you, and at the end they'll sit down and give you some feedback about how you went, how you thought you went, and maybe talk about some goals for improvement for the future. So that's what this tool is for. So you'll need to complete the mandatory ones, which are the physical assessment, personal hygiene on page 17, personal hygiene 2 on page 18, infection control on 19, patient mobility here on page 20, and part 2 of patient mobility on 21. The next ones are all optional, but as I said, most people will find that they complete these competencies, most of these competencies on placement. So we'll just go down through all of those until we get a little bit further down to our appraisals. So you'll find there are 2 types of appraisals in the performance appraisals in the document. These also need to be uploaded to Moodle within 4 days of your clinical placement. So an appraisal is about sitting down with your educator and talking about how you went. All of these are based on our professional standards from the Nursing and Midwifery Board of Australia. And they go through and they'll have a chat to you about how you went. So basically the idea is that you have a look at this and you rate yourself here down these columns as to whether you think you're expert, independent, marginal, dependent, or if it doesn't actually apply to the setting that you're in. So we expect all of you to be at dependent or above. This first one here is a formative assessment. So if you feel that you're struggling, or if your educator feels that you need some feedback halfway through, they'll sit down and do a formal appraisal with you at the end of the first week of your placement. There's 2 pages of those, and then at the end there's some general comments and feedback. So the clinical facilitator will fill out some general comments and feedback about how you're going here, maybe identify collaboratively with you some areas of practice that need further development, and then you can write in your own comments here about how you feel you're going and what you'd like to get out of the placement, or where you need to be towards the end. Then they'll fill out whether or not you satisfactorily completed that, and the total number of days that you're absent. So that's a formative one. You'll see that's stamped heavily here. The formative one is to do halfway through your clinical placement. The next one is a summative appraisal. Now this one is not optional. This one has to be done towards the end of your clinical placement. And this is how you went overall. So it's the same document, but this time this is your final appraisal at the end of your clinical placement. And this is not an optional one. So once again, there's 2 pages of the table to fill out. Once again, you'd fill it out yourself first, rating yourself against each criteria here and down here, and then your educator will come along and pop down where they think you're at, and then you'll have a discussion and fill out this back bit here as to how you went, and maybe some areas of practice for when you come back to university and then go out on your next placement next year. So once all of this is done and your placement is over, you need to take this document from, I'll just scroll back to where we were, from this page onwards, so from page 14 onwards, you need to scan that into a computer and upload all of those documents to Moodle within 4 days of finishing your clinical placement. And remember, this is a hurdle of the unit, and therefore if you don't upload this, it could in fact mean that you fail. So pretty easy to do, but let me know if you need any help with that. So do download this document, have a bit of a think, keep an eye out for the updated poster about uniform regulations. Remember, you're representing the unit, not only yourselves but the university. This is a profession. We have very high standards of our registered nurses, of our enrolled nurses, as well as our student nurses. So, put on a good show out there. Remember your patients' privacy and confidentiality, and really put your best foot forward. Have a read through this. If you have any questions towards next week, the week before you go out on placement, let me know, and we'll answer them there. So good luck out there, and really enjoy your placement. It's a great thing to do. Okay.